New at 6, Native American suicide rates are alarmingly high, and the ongoing crisis is impacting tribes all over the country. Suicide is the leading cause of death for Native youth between 10 and 24 years of age. That's according to the National Indian Council on Aging. Tribal leaders, lawmakers, and mental health experts all meeting today talking about ways to combat the problem. News Channel 3 Shay Lawson live in Banning at the Morongo Tribal Council chambers where that meeting was held today. Shay.
John, that's right. The meeting opened up with emotional testimonies from local tribal leaders talking about increasing suicide rates among youth and a call to address mental health. Today's discussion brought together local tribal leaders, lawmakers, and mental health experts together to address why this is and how their organizations can work together to combat the issue.
It's an issue that hasn't really been looked at deeply, in depth before, and I think it's time.
A step towards addressing the mental health crisis facing Native American youth.
I'm a mother, a grandmother, and a great-grandmother, so I care. I have children, I have grandchildren, I have great-grandchildren. So yeah, it's time that we really focus on this.
Marianne Andreas, a Morongo Tribal Council member, sat alongside other tribal leaders, lawmakers, and mental health experts at a public hearing on Wednesday to discuss the high suicide rates affecting Native American communities.
We've known over decades that non-communities of color have a much greater rate of suicide than other communities.
Data from the California Department of Public Health shows Native people have the highest rates of substance-involved deaths, serious mental illness, and the second highest rate in the state. In 2020, Assembly member James Ramos created Assembly Bill 2112, which established California's Office of Suicide Prevention. He helped organize Wednesday's discussion and says there still aren't enough resources.
There's a lot of times that people wouldn't talk about these issues. You heard tribal leaders talking about how resources, right, are hard to get to. You heard another tribal leader talk about how Native Americans are the most studied people, but yet when it comes to issues like this, resources are far from coming in.
Several state officials, including the Mental Health Services Oversight and Accountability Commission and California Department of Public Health, provided updates on ongoing efforts and outreach plans to help Native Americans both remotely and in person. As the meeting ended, there was a shared sense of urgency and call for collaboration to turn the discussion into tangible solutions.
Well, I think it brings to light a lot of the issues that individual communities are facing, individual families are facing, the children themselves, bullying, depression, intergenerational trauma. All of those issues come to play, and we need to come together and find a better future for our children.
Some of those solutions attendees discussed today were making mental health resources more accessible to Native American communities and increasing the representation of tribal leaders as behavioral directors. Assemblymember Ramos says he'll send a letter to Governor Newsom about today's hearing. And if you need help, experts say to call or text 988 or go to 988lifelong.org to reach the Suicide and Crisis Line. Reporting live in the Morongo Reservation in Banning, Shay Lawson, News Channel 3.